Good afternoon, dear President of the Scientific Committee and colleagues around the world. Thank you very much for giving me the opportunity to be here to present the works in our center. My name is Liu Yan. I come from the Gynaecological Day Surgery Center of Chengdu Women's and Children's Central Hospital. Today, I'm honored to share the topic Auricular point sticking combined with ERAS in Gynaecological Day Surgery Center. And this is the Day Surgery Center in our hospital. Our center is founded in May 2020. And this is the team members in our center. The background. As we all know, that since the ERAS implant in more and more surgery centers, patients are really benefited from this idea, even though there's still 20 to 40% patients suffered from gastrointestinal distension, nausea, and vomiting. So based on that and related researches before, we're thinking that if combined ERAS with auricular point sticking and acupuncture could improve patients' recovery after surgery and diminish the gastrointestinal complications. And then the inclusion criteria. Patients who accepted laparoscopic single-site surgery in our center are enrolled in this experiment and who are willing to take this treatment without gastrointestinal diseases and skin infection. Methods. Treatment were operated during 1 to 4 hours after surgery. Stickers with one were stuck to spleen, stomach, and endocrine points on ears. Acupuncture were used to 肋关、合谷、三阴交、足三里 and 中脘 and stayed for 30 minutes. Abdominal distension were evaluated at 1 hour after treatment and the next morning after surgery. Acupuncture and auricular point sticking were practiced by experienced acupuncturists in traditional medicine department in our hospital. So these are points we chosen in our center, including 中脘, 天枢, and 合谷. And these are showing us where the point is. This is 内关 and 足三里. Spleen, stomach, and endocrine on ears are elected in our experiment. So why we choose these points? Because acupuncture were used for thousands of years in China, but the basic theories are still not clearly enough. Now, with the development of technologies, the mechanisms are gradually unveiled. Some researchers showed that acupuncture may play an anti-inflammatory role by stimulating vagus nerve, and it can also regulate gastrointestinal hormone secretion like motilin, cholecystokinin, gastrin, and vasoactive peptide, etc. In addition, acupuncture can regulate intestinal interstitial cell of capsule to reverse the decreased expression of c-KIT in chronic ICC, which can increase the slow wave activity of intestinal. And this chart shows that the operation method of 53 cases. There are 21 cases underwent the ophrecystectomy and myomectomy are 13 cases, including 2 cases of hysterectomy, 47 cases with NES, and 6 cases with V-nodes. This chart shows the observation indexes, including the operation time and the first annulus exhaust time, hospital stay, and patient's satisfaction. The first annulus exhaust time is about 6.84 hours after surgery, and the hospital stay is about 26.87 hours. Patient satisfaction is about 96%. Most of these patients expressed that they would like to take this treatment again, and only 2 cases showed that they don't want to take this treatment because of fear of acupuncture. And this chart is about the abdominal distension score. The higher the score is, the severe the symptom is. We can see that more than half of them only have a mild abdominal distension without obvious pain. 16 cases did not feel abdominal distension, and only 1 case expressed a significant abdominal distension. Although the consequences are optimistic during the past few months, there still more work needs to be done, and a randomized control trial are in progress in our center. In the end, thanks again, dear President of Scientific Committee. Thank you for your approval, and it's really inspiring to us to carry on this job, whatever the consequences are. And thank you, every colleague around the world. Thank you for your attention, and we hope that every one of you could keep safe in this situation.